Hi, my name is Hiba, and today I will be explaining what exactly is a p-value. Really? In scientific research, we see p-values a lot. In the beginning of the academic journey for most students, seeing a p-value less than 0.05 means that we found something significant, something important, and something worth celebrating. But really, what does a p-value of 0.05 even mean? Imagine that you have a coin and you want to know whether this coin is fair or not. In other words, when we toss the coin multiple times, is the probability of getting either heads or tails 50%? First, we define the null hypothesis where we assume that the coin is fair. Hence, we will get tails 50% of the time. The alternative hypothesis is that instead, the coin is weighted. If the coin is weighted, we will observe tails less frequently or more frequently than 50% of the time. In order to answer the question, we assume that the coin is fair, in which case the heads probability is 50%. We flip the coin the first time and get heads. Are we surprised by this result? Not really, since there is a 50% chance of getting a head. Therefore, the p-value here is 0.5. So we flip the coin again, and it lands on heads again. This is also not that surprising considering that there is a 25% chance of getting two heads. Now we flip the coin a third time and we get yet another head. Getting three heads in a row with a fair coin is not exactly common, but the probability is still a considerable amount, which is 12.5%. In the fourth toss, we get another head. The probability of getting heads four times in a row is only around 6%. And finally, we toss it a fifth time to get another head. The probability of getting five heads in a row using a fair coin is only around 3%. Here, we start to suspect that maybe the coin we have is actually not a fair coin. In other words, the p-value for this outcome is around 0.03, which is less than the significance level of 0.05. This is the basic idea behind p-values. A p-value is the probability under the assumption of no effect or no difference, so when the null hypothesis is true, of obtaining a result as extreme or more extreme than what was actually observed. Traditionally, we would say that we have enough evidence to reject the null hypothesis that the coin is a fair coin. Now, in the context of clinical trials, we use the p-value during hypothesis testing. Suppose that we want to know whether the red drug is more effective than a placebo blue drug in lowering blood pressure. We would ideally conduct a randomized control trial and assign the placebo blue drug to the control group, while the red drug is assigned to the experimental group. Then we can calculate the mean blood pressure of each group and find the difference. In this example, the red drug lowered the blood pressure by 4 millimeters of mercury compared to the placebo. Is this a statistically significant decrease in blood pressure where we can say that the red drug is more effective? To answer this, we will calculate the probability, or the p-value, that we would observe a 4 millimeters decrease in blood pressure, or more extreme, if we assume that there is no difference between the two drugs. That is, if we assume that the null hypothesis is true. The p-value can be calculated through several statistical techniques, which depend on the study design and objectives. If the p-value is 0.02, for example, we would traditionally conclude that we have enough statistical evidence to reject the null hypothesis. That is, if the mean blood pressure between the control and the experimental groups were the same, there is a 2% chance of observing a difference of 4 millimeters or more between the two groups. Now, if we say that a difference of 4 mmHg is statistically significant, Does that mean that it is actually clinically significant? Is this difference actually important for a patient? Also, why is the cutoff at 0.05? Why not make it more strict, like 0.01? Or just an arbitrary number like 0.067? When making clinical or public health policy decisions, a p value is usually not enough. At minimum, the effect size should be reported. This will help us ascertain if the finding is clinically important. Another essential measure is the confidence interval, which help us see the lower and upper limits of our measure. What is the best and worst case scenario? For example, the red drug can decrease blood pressure anywhere from merely 2 millimeters up to 6. When it comes to setting a significance level, there are a few considerations to take into account. First, no matter what the significance level is, it should always be determined a priori before any experimentation is conducted. A p-value may be lowered or raised from 0.05 depending on the objectives of a study. For example, we may want to lower the significance level to 0.01 if we are testing a new, untested, and potentially harmful treatment. For instance, when we want to test a new vaccine. It can also be raised if we are instead testing effect modification by a third variable, which refers to the impact of a third factor on the treatment outcome relationship. An example of this would be if older patients are more likely to respond to a certain treatment regime compared to younger patients. The relaxation of the significance level should be based on how willing the researchers are to conclude that a third variable, in this example the age, has a meaningful effect on the relationship between the treatment and the outcome. Finally, performing multiple statistical tests within a single study increases the rate of false positives. At a significance level of 0.05, if we perform 20 tests, we have a 64% chance of observing at least one significant result simply due to chance. In this case, we adjust the significance level in order to lower the rate of false positives. And finally, I will leave you with a few recommendations from the American Statistical Association. They published an article titled Moving to a World Beyond P-Values. First, they recommend that you should not base your conclusions solely on whether an association or an effect was found to be statistically significant, or whether it crossed the threshold of p less than 0.05. They also explained that you should not believe that an association or effect exists just because it was statistically significant. On the other hand, you should not believe that an association is absent just because it was not statistically significant. Don't believe that your p-value gives the probability that chance alone produced the observed association, or the probability that your test hypothesis is true. Remember that a p-value does not describe a hypothesis as true or false. It describes data. And finally, don't conclude anything about scientific or practical importance based on statistical significance or lack thereof. Having a p-value of less than 0.001, for example, does not mean that the effect size is large or important. And thank you for listening to my presentation.